All right, guys, I'm Amber. I'm the nurse practitioner at the Nobu Skin Med Spa in Denver, and I'm so excited for y'all to be here. We are here to talk about semaglutide. So I am a doctor of prepared family nurse practitioner. I have been practicing for the last 14 years and specializing in aesthetics. I really enjoy the weight loss program. Um, Okay. And then, so I have been constantly researching and educating regarding beauty and treating ourselves on the inside versus the outside because Botox and filler can only take us so far. So, a quick little overview before we get started. We'll talk about the what we offer at Nobu Skin at our med spa, our weight loss options, introduction to semaglutide, benefits and results, how to book your treatment, any questions and answers, and we will talk about our great giveaway. Okay, so today I'm very excited. So our giveaway will have 2 grand prize winners. So everyone that has joined the webinar today will receive 2 weeks free of semaglutide for everyone. And stay tuned until the end to participate in this live giveaway of 2 months free weight loss program, which is an $800 value. Very excited about that. So, about our med spa, Novu Skin is a leading wellness and aesthetics members club with over 5,000 members and 20,000 satisfied customers in Las Vegas, Denver, and Frisco. Um, Personalized treatments, we offer a wide range of services, including advanced face body treatments, medical weight loss, cosmetic injections, BHRT, which is bioidentical hormone replacement therapy, acupuncture, and laser hair removal, just to name a few. We have performed over 250,000 successful treatments, showcasing our commitment to proven results and client satisfaction. So, the fundamentals of weight loss. So, basics of weight loss: diet, exercise, lifestyle changes, common changes in weight loss, and importance of personalized approach. So, non medical routes to weight loss diet plans can be keto, Mediterranean, plant based. There are a wide range. Exercise regimens such as cardio, strength training, lifestyle adjustments, sleep, stress management, and mindful eating. So, medical routes to weight loss, prescription medications, surgical options such as bariatric, liposuction, etc. The role of medical supervision in weight loss. So, what works and what doesn't? Evaluating the effectiveness of weight loss methods. So, success rates of different diets and exercises, pros and cons of surgical weight loss methods, limitations and risk associated with certain weight loss options. So, I'd like to talk about that a little bit. So, we consider there's always a new diet fad. There's always something new on the market, and diet fads will only take us so far, and then our bodies have memory. So we can stick to a diet for a certain period of time. However, if we get off of that diet, that can have a tendency of um, making us making us regain that weight if we don't stay consistent with. So understanding semaglutide. Semaglutide is a GLP-1 glucagon-like peptide receptor agonist and works by suppressing the appetite along with feeling fuller faster. This medication is also used together with diet and exercise to help lose weight and keep the weight off in patients with obesity caused by certain conditions. So semaglutide benefits. One out of three clients taking semaglutide have achieved greater than 20% weight loss at 68 weeks. The first and only once weekly GLP-1 for chronic weight management. Semaglutide is a prescribed medication used along with a reduced calorie meal plan and increased physical activity that may help adults with obesity or excess weight who also have weight related medical problems to lose weight and keep it off. So, a couple before and after pictures I will share today. And these are of actual clients that we've had at Novu Skin that have started that semaglutide weight loss journey. So, something to consider with this medication that I have found with clients that meet with me for a consult is semaglutide can also change the brain receptors a little bit. So I've had clients tell me, I'm not drinking wine as much as I was, or I'm not interested in it, or I'm no longer smoking or vaping. I was able to kick that habit. I've had clients say, I don't want the bag of chips. I want the grapes or I want the apples. My body's telling me I don't want the highly processed foods any longer. I've also had clients say, in the sense of, I'm not sitting at home scrolling on my phone any longer. I am getting up and I'm moving around and I am having more energy. So it's really great. So the treatment process that we have, we offer flexible in clinic, or we are now offering telemedicine visits, what I'm really excited about. Clients have the option to visit us in clinic or opt for telemedicine consultations. So if you're located For example, in Colorado, I'm certified in Colorado. So if you're in Colorado Springs and you can't make it to our clinic, then I can meet you online. So consultations via telemedicine are conducted over the phone. Simple call us to schedule a consultation with me. Upon approval, we'll ship the necessary vial and syringes directly to your home. Telemedicine services are available statewide in Nevada, Colorado, and Texas. So the treatment process, clients will start semaglutide at 0.25 milligrams once a week, and follow the dose escalation schedule. So the initial treatment will be the semaglutide 0.25 milligrams once a week for 4 weeks. So the titration schedule, on weeks 5 through 8, we will increase to 0.5 milligrams of the semaglutide. Weeks 9 through 12 will be 1 milligram of semaglutide. Then weeks 13 through 16 will be semaglutide 1.7 milligrams. And then the max dose will be 2.4 milligrams of semaglutide weekly. So when it comes to maintenance and titrating off doses, those are definitely client specific. So usually with my visits, whenever we're in the office or if we're doing telemedicine, I need to hear the words, Amber, I have reached my weight loss goal. Then we will start discussing how we're going to titrate off this medication. Because I do not want you to stop it abruptly because that hunger can come back with vengeance. And when that happens, everything that you've invested in yourself can just basically just go away. And I want you to continue being successful even after you stop this medication. So why is semaglutide right for you? So qualifications, anyone over the age of 18 that has concerns regarding weight loss, consults are always free. Not qualified, anyone with a personal family history of medullary thyroid cancer or liver abnormalities. Qualifications are individualized and will be addressed during our initial consultation. So a lot of common questions that I come up to is when will I see the weight loss begin? So everyone is different. I usually say, for the first 4 to 8 weeks, we may notice 1 to 3 pounds of weight loss per week, and that increases as that milligram dosage increases. So, will I have to take this medication forever? Yes and no. It depends on you. If you want to be on this medication for a longer period of time to help with maintenance of keeping that weight off, then we can do that. But if you don't intend on being on anything for a long period of time, that is okay. We will cater this treatment specifically for you. Are there side effects? There are side effects to this medication. So, side effects such as nausea, vomiting, constipation, reflux, or diarrhea. So, a lot of times when clients are complaining of nausea or vomiting, I will ask them, what did you eat? So, a lot of times your body is trying to tell you what you Did you really want what you so if it's like processed foods, like I ate a cheeseburger, that may cause nausea. So your body's trying to tell you, I want healthy food choices. You must stay hydrated with this medication that will help prevent nausea, will prevent constipation. With reflux, a lot of times I'll make recommendations over the counter, but of course, having a qualified nurse practitioner at the Novu Skin, if there's anything that we would have to drive to your local pharmacy, we can definitely do that if to handle any of those side effects. So, how will I promote my weight loss journey to reach my goals? We will discuss proper nutrition during our consultation, as well as exercise that brings enjoyment and happiness to reach your weight loss goals. I can tell you to go to the gym 3 times a week for 30 minutes, but if you hate going to the gym, you're not going to be inspired to stick with this program. I want you to find something that makes you happy. So, if it is Pilates, if it's swimming, if it's going for a walk, um, you know, Zumba classes. I just want you active and happy with what you're doing. So, why is semaglutide different from other weight loss medications? So, it is a weekly injection compared to other oral formularies designed for weight loss. If semaglutide is stopped, the body doesn't remember being on that medication. Some oral medications, the body will remember and eventually start working against the medication. Since semaglutide circulates through the bloodstream and not the GI tract, you can start the medication again without concern if it will work or not. So I get this question a lot. If I miss a week, how would it impact my progress? Life happens, we go on vacation, we get sick, just different things happen all the time. So we will pick up where we left off the week before, missing that dose and get back on schedule for your weight loss journey. So, are there any additional health benefits to weight loss? Absolutely. Improved health and well being, more energy, the ability to possibly come off prescribed medications. I don't know how many people I've met that are no longer on blood pressure medication, no longer on cholesterol medication, sleeping good at night. They have just an overall healthier lifestyle modification. It's really cool. Is losing more than 3 pounds a week considered normal? Everyone responds differently to this medication. One person may lose 1 pound, someone may lose 5 pounds when starting off. So it's really just catered to your body and how you respond to it. And it's also depends on how you set your goals. Can I still get this treatment if I like to travel or don't live near the spa? Yes, you can. Our telemedicine services are designed to accommodate clients who travel frequently or reside outside the vicinity of our spa location. As long as you're within the states we operate in, Nevada, Colorado, and Texas, you can access our consultations and services remotely. Okay, so can see the participants. Yes, I can. I'm looking at some of the questions right now. Um, if you have previously been on semaglutide, where do you start or how do you know where to start? So we can just start with a consult. Um, and it just depends on when you were last on the medication. If you've been on the medication longer than a month, we would probably have to start completely over. Okay. So, what is the B12 for? So, great question. Thank you, Claudia. Um, the B12 is for energy and it actually helps with metabolizing the food that you're taking in. So, whatever you don't use from your energy stores, you will excrete it. Okay, so let's see who our giveaway. Okay, so in order to be a candidate for our giveaway today, I need you to text webinar to 972-970-2630 in the next 5 minutes. There will be two grand prize winners that will get 2 months free of the weight loss program, um, which is a great win. $800 value. An extra bonus is 2 weeks free of semaglutide for everyone that joins today. Okay, I'm giving everyone a minute to have a chance to text webinar, and then we'll keep moving on. Okay, I'm giving everyone a minute to have. Okay. All right, question and answers. Okay, I was told to give the, I'm so sorry. I just got a notification that I needed to say the number slower. So 972-970-2630. So sorry about that, y'all. I am Southern and sometimes I talk fast. Okay, so while y'all are doing that, we will go to the question and answer session. So please feel free to send all your questions through the Q&A, and I will be happy to answer them. So, what do you recommend to do after we reach the weight loss goal? That is such a great question. Thank you. Um, We will titrate off the medication, and then you should be at that point where you have a consistent schedule of managing your lifestyle modifications. So with diet and exercise, and just if we need another consult to talk about other things, we can definitely do that. Okay, so I got my first B12 shot yesterday, and when I went to the restroom, urine was pink. Is that normal? Yeah, it can be. Yes, that is very common. So your body metabolizes the B12 that it needed, and then it excreted the rest. So I have a history of PCOS. PCOS is polycystic ovarian syndrome. Will this help with regarding weight loss? Absolutely. It definitely can help with that. And also, we are going to be offering bioidentical hormone replacement therapy at Novuskin. I'm very excited about that. So that is something we can definitely talk about to possibly help with managing your PCOS. So stay tuned for that. That's coming soon. Another question. There is there any connection between your hormone levels to lose weight? Absolutely. I find that semaglutide and bioidentical hormone replacement therapy, I treat them like they're cousins. They play very well together. So we should be offering that very soon, and we will be hosting another webinar regarding hormones very soon. So very excited about that, and I can't wait to share that information with you. Okay, I started donating plasma end of December. Is it safe to get the injections if I continue to donate plasma? I do not see why not. In regards to donating plasma, we can talk more about it during our consult, but I don't feel that there's any contraindications. Should I take the semaglutide shot with the B12? I think that they work great together because while you're suppressing appetite, you are actually utilizing the food that you're taking in for energy. So absolutely. How many minutes and days of weeks should we work out? That is catered to you. I'm one of those that I attend a class that I keep myself accountable. That way, I go to an hour class maybe 3 times a week, but it's more so I want you active at least 3 times a week. If it's 30 minutes, better than no minute. So let's see. What are the benefits of different packages, 12 weeks versus 20 weeks? That's a great question. Thank you. So I would definitely recommend the 20-week because that gives us the option. So if you reach your weight loss goal at just 1 milligram, then we still have, multiple syringes to help titrate down. It also just depends on you. Um, So when will I start noticing the results? Everyone's different. When I started semaglutide for myself, I started noticing that week. And that was just a few weeks ago, especially with the B12, that has been amazing for me. Okay. So how much weight can you lose? Everybody is different. Usually 1 to 3 pounds is what I stick with for the first 4 weeks, and then it can go up to 4 to 5 pounds, and then it can continue. The higher the dosage, the more potential of weight loss you can have. It just depends on how assertive you're going to be on your weight loss journey as well. If you're more sedentary than active, we might not reach our weight loss goals as quickly. So staying active and following a healthy nutrition diet along with the semaglutide, they all work so well together. Does it matter if you squeeze the skin during injection or does that even matter? That's a really good question. So I like to pinch the skin. I say you can inject wherever there's a little bit of love. So you can do deltoid, you can do in the abdomen, you can do the flank, you can do the buttocks, the thigh, just pinch and press. Okay. What would be an ideal way to start this at like over 200 pounds? Honestly, I do not follow a BMI. I've never been a fan of that. That's more so of I want you to feel your best self. So it's just a matter of even if you are in that BMI range, if you're not happy with the skin that you're in, we can talk about it and create goals together. Does semaglutide need to be refrigerated or frozen? That's a really good question. Thank you. The semaglutide must be in the fridge. Absolutely. Um, I didn't know we could do over the phone. Is that okay in Texas? Absolutely. We are located in Texas and Nevada and Colorado. So minimum age is 18 years old. Is there anything we should do to target certain areas we would like to lose weight? So I would like to say it just depends on what what's bothering you. Now we also offer other services within the med spa um, regarding uh, Morpheus treatments, cryo. We have so many other options as well if there's specific areas that are concerned. How do we set a consult? That is a great question. Thank you. You can give us a call or you can shoot us a text message and we can make that happen for you. We have someone available at each med spa every day. We're here Sunday through Saturday. Okay. Do you recommend to lower the dosage after you reach your weight loss goal and not stop at the highest level? Absolutely. I would definitely recommend to not abruptly stop it. Please let me know or let one of the providers know at the other med spas that, hey, I'm ready to titrate down because, like I was saying, that hunger comes back with vengeance, and you've made such an investment in yourself, and I want you to be successful continuing on. So, yes, let me help you titrate off of this medication. Also, what I was going to mention, I do have some clients that um, I am so sorry, forgive me. I do have some clients that will do one monthly injection, like they're, hey, I have a family gathering or a reunion that I'm going to, and I know that they're going to be cooking some good food, so I just need one for the road. Or, especially in women, they know that their hunger is excessive during their menses or when they're ovulating, so they'll do an injection that week, and then that's how they continue on the regimen. Should we have gotten a text back from the number? No, we should not have. I am checking on the question regarding the FSA, if FSA is covered. Okay, as long as it is a Visa Master, then the FSA is okay. Awesome. Okay. Okay. And regarding the 2 weeks free, I'm already in the program. I would just call the uh, one of the local med spas and they can discuss that with you. Okay. Keep moving on. Okay. And we have our grand prize giveaway winners. So it looks like Lucy Fajard and Ellen Farr. Congratulations. Okay. And do we have any other questions or concerns? Like, I'm more than happy to answer. Let's see. Yeah, so excited for you, Lucy. That's awesome. Absolutely, Jennifer. Thank you for stopping by. So, in regards to the question that was related, um, we will honor the 2 weeks for attending, even if you've already started the program. So yes, definitely. Will it be affected by the skinny shot that I already get? I love adding the skinny shot with it. I think it's one extra boost for the week. With the vitamins, those metabolize within 7 to 10 days. So I think it's great to have it. Absolutely. Jennifer, the skinny shot is a lipoic acid. It is a peptide that helps flush out the liver, but it can also help with curbing the appetite as well as helping you feel full faster. Can I clarify the BMI? I heard that it is required 27 BMI or more. Not necessarily. It really depends on the client and their questions and their concerns. We can make slight adjustments, definitely. So a lot of times, when we're struggling to lose weight, especially once we reach our mid-30s, our bodies hit a plateau. Our metabolism is slowing down. So a lot of times we just need a little help. So that's why I'm very excited about the semaglutide for the weight loss program, but also that we're going to be introducing bioidentical hormones to No Boost soon. So keep a lookout on that because it really works so amazing together. Okay. Any other questions? If you are in menopause, do you need any testing before starting that? Um, Absolutely not, because we will be offering that here. So we are getting everything set up to where we'll be able to draw blood, and I will be reviewing the labs with you, and we will create a game plan. I am finding out about will we receive an email detailing the 2 weeks free? I'm finding out for you, dear. So it looks like the office staff, they will be calling. So good question. Thanks. Okay, any other questions, my friends? So, of course, if any other questions arise, please feel free to schedule a consult. Consults are always free, especially if you only have questions. You can give us a call, you can send us an email, you can text. We have plenty of different modalities of communication. So I just want to say thank you so much for attending this webinar with me today. It was amazing. I'm so happy that y'all are all here to join. Um, but other than that, let's but y'all have a great day and see y'all at Novo soon.